All right, fantastic. Well, good afternoon, everybody, and thank you again. As stated, I am Craig Rudzeski, and I guess they call me the Director of Senior Product Sales with the company. I don't know, I guess I wear a lot of hats, so I guess that's an appropriate title, but I'm just glad to be here today. Excited for all these great opportunities and to share all of that information with you guys here today. So thank you all for joining and taking time out of your day to be here. Real quick, I usually just kind of like to do just like a quick little about us, just so that way, for those that aren't contracted with us, definitely, give some context as to who we are as a company. So, National General as a whole, or National Health Insurance Company, traces back all the way to like 1940. So to say that we're a new company would be a mere understatement. I mean, we've been in existence for quite some time, formerly known as Intagon, maybe GMAC, as well as even Time Insurance Company. These are all names that we've historically gone to. And then, of course, most recently, National Health Insurance Company is more or less our underwriting company. And that's more or less what you're seeing in CSG is National Health Insurance slash Allstate. Well, we got acquired by Allstate at 2021. So yes, we are officially an Allstate company now. I'm super excited about that. And that now gives us an A+ rating or superior rating with AM Best. So again, just kind of taking like our history of national health since 1940, fast forward to 2001 with Allstate. We're definitely a financially strong company, not just financially strong, but we are definitely a well-recognized company. We've got a broad portfolio of super easy products to sell that obviously fit a wide variety of need for your clients, basically anywhere from birth all the way up to now retirement these days. And we've got some pretty awesome technology, of course, with the help of CSG and some other partners to obviously help in getting those quotes and making those enrollments that much easier. Now, why are we here? And of course, what makes our new product so awesome? Well, we've done a lot of work and we've implemented what we call our multi-discount Medicare supplement programs. And so that's where a lot of these questions probably are coming from, especially as working with such a great company as CSG. Is it's very difficult to display every single discount that we now offer in a way that is as clear and concise as I think we would all want it, right? Again, in a perfect world, we would maybe have check boxes or everything would just be right there in front of our face. I get it, totally understandable. But we're just difficult and we're just like making people, no, I'm just kidding. Obviously when you're making changes and you're starting to change things up, it's just going to take a little bit of understanding. And so we're kind of at that point right now is how to understand how to quote. And so obviously CSG has done a great way of displaying those results back. It's just we have to go a couple of steps further to one, just understand the product, to understand who may be eligible for the various discounts. But then further, I think the most important thing is understanding where you can locate within the quote what discounts are being pulled into the rate that you're actually seeing there, because that's going to be important. I mean, obviously it's seeing it, but then understanding who's going to be qualifying for that is kind of going to go hand in hand. And so again, what you'll see in CSG, of course, when we go through the demo, is you click on an arrow to the right. It's going to open that up. And that's going to display the rating class. And within the rating class, that will depict for you, or it'll break down. This is comprised of the preferred select, household discount, roommate discount, dual applicant discount, the wearable discount, things along those lines. But the rating class within the drop down of that box in CSG is where that's going to be displayed. So again, as you're running quotes, as you're looking at all of our awesome rates, and you see Allstate and National General or National Health Insurance is occupying the top 4 spots. You just need to click on the arrows on the side to drop it down and make sure that you pick the correct one for your client before you go into the enrollment, to make sure that that is the appropriate quote for the various discounts and or not discounts that they don't qualify for. So again, just make sure you're careful with that. All right. But again, what we talked about, multi-discounts, we can provide up to 25% savings off the Medicare supplement program. This won't be visible in CSG, but I just put it in here as well, that if they do bundle, there's the potential that they can save off of their dental plan as well. So if they buy our Med Supp and then buy our dental plan at the same time, they can get some discounts there. We also have a new underwriting class, which is called our Preferred Select. and Preferred Select is available. Just think of it as like for those super healthy individuals. So if they meet the height and weight requirements and or the tobacco requirements and have not taken any medication for depression in the past 5 years, they can qualify for our Preferred Select underwriting class. That in and of itself not only does give a little bit of discounts, but it primarily will prevent the attained age increases within the first few years. Okay, so it basically stabilizes the block and provides some additional savings above and beyond just the 25% as well. And then further, as a company, why else would you look at us if the discounts aren't enough, if the preferred underwriting class isn't enough? We've got some pretty easy resources. Of course, our online portal. I know we're going to be looking at the CSG portal today, but of course, within ours, we've got multiple functions that allow you to do enrollments via a passphrase or a security question. And then, of course, the instant decision and instant ID cards are definitely some resources that a lot of people like because it does give them real-time feedback as to what's available and if it's been issued or not, right? That's important, I think. So all those great things, but what's new? Well, we're transitioning to Allstate. So for 10-1, in about a handful of states, we're going to be transitioning to Allstate Health Solutions. So pay attention to that, okay? I'm throwing it out here because if you're looking for national health insurance and then in parentheses Allstate, come October 1st, some states are going to say, American Heritage, and then in parentheses, it'll say Allstate Health Solutions, okay? So pay attention to a slight little change that's going to be coming in October. And then, of course, we also have these enhanced enrollment capabilities through CSG, where now you guys can complete your enrollments straight through CSG. So you no longer have to go back and log into our portal. It can all be done directly through CSG, which is just going to make your time and your experience that much faster, that much better. And obviously will translate to a great experience with the client as well. So I couldn't resist.
I'll give you, sorry, I don't mean to interrupt you or anything, Craig. I will just say everything that Craig's showing you and like where to find Allstate, we'll point all of that out here very, very soon. I have some questions coming in. So we'll show you how you can find them, whether you're searching for Allstate, National Health.
Okay.
We'll give you all the insights to finding them on CSG.
Awesome. Sounds good. I figured you would, but just wanted to, glad to hear that for sure.
Yeah.
So here are the initial states where we're launching with the American Heritage / Allstate Health Solutions Charter, okay? I know it's only a few, so it's very underwhelming for right now, but we're starting off with just a swap with the Allstate brand. It's going to be a phased approach, okay? So we would expect that these are the states for 10-1 that'll have the Allstate brand and the reduced pricing, okay? Then if we fast forward, okay, we're going to look at all the states that have the multi-discount as well as just our entire footprint, okay? So I just wanted to put this out here so you guys can see we've got a wide footprint of where we offer benefits. And if you're doing business in any state on here that is green or orange, you should be selling our plans. You should be looking at Allstate National Health Insurance because in these markets, these are the areas where with our multi-discount and our reduced pricing, not only if we add Allstate to it or not, we're going to have the top ranked plan in the market, okay? Whether it's the annual discount that's going to get us there, whether it's that 5% wearable discount that'll get us there, by adding at least one of the discounts in any of these green or orange markets will make us the top plan in that market if we aren't already, okay? So just wanted to really kind of throw that out there to you guys so you had an idea about that. Again, these are just a listing of the states and an area to show where we took reduced pricing and when, just as an example, so you guys have that as a reference point. And then the most important thing is what are these discounts? So how we get to the 25%, in most markets, it is a true roommate discount. So if they reside with somebody 50 years of age or older for at least 1 year or longer, they'll qualify for the 7% roommate discount, okay? No requirement on them being married, no requirement, again, in most markets of them being a member with our plan as well. Okay, as long as they have somebody that they're just simply living with, they can get that 7%. Now, we decided to take it a step further, that if that other individual is also of Medicare age and eligible, let's say that other individual also applies for coverage as well. As long as they both apply, if one policy or both policies are issued, they'll get the 10% discount, okay? Some carriers require both policies to be issued in order to get the dual applicant discount. And so I've heard a lot from a lot of different agents. They don't like that. That really isn't a value, and they kind of try to stay away from that because at the end of the day, if that second policy isn't issued, nobody's getting the discount. Therefore, there is no value there anymore, and they probably just lost both of those sales. With us, as long as they both apply, if only one policy is issued, it would still get the 10% discount. So we are honoring this in a way that is valuable in the circumstance, okay? Furthermore, annual pay discount. So if they're willing or in a position where they can pay their premium annually, we will give them a 10% discount. I've got plenty of agents that have already integrated this as part of their needs assessment questions. And first and foremost, they ask that question, and if that answer is yes, they almost don't even need to look anywhere else. They just go directly to us, pull up our rates, confirm it in CSG. Then, of course, if they need additional information, they can download from our portal, whatever. But they know that with this 10% discount, we will have the lowest rate in the market. And then, of course, the activity tracker. So we get a lot of questions on this. Activity tracker, you're right. Fitbit, Apple Watch, there's even Under Armour, and I think Garmin make devices that are compatible as well. In essence, most smartphones even have capabilities to track steps and have a health app or something like that within there. So in most of those cases, as long as it is a compatible device and they register that device through their member portal onto ours, we'll give them that 5% discount, okay? The biggest questions that I get asked is, what are we looking at? What are the daily requirements? Are there step minimums? All of these things, just trying to cast the widest net. Again, the only requirement we have is for them to register the device. That's it. There is no minimum step count. We're not monitoring their heart rate or blood pressure or anything else like that. Again, the only step they're required to take is have a device and register that device in the portal, and they'll maintain that discount. Okay, so that's pretty much it. I know I kind of ran through those pretty quickly, but I think it's pretty straightforward. We do have additional definitions within the underwriting guide as well as in our senior producer agent guide. So there's additional information there. If there's any questions, concerns, of course, you guys can reach out to myself. I'm happy to help in any capacity possible. My information will be forthcoming in just a moment. Again, wanted to talk briefly about the preferred select. So again, I said height and weight requirements, right? They need to fall within the preferred select category. So if somebody was 6 feet tall, they would need to be 137 to 220 pounds to qualify. No tobacco in the past year. And there's one additional question to qualify for the preferred select, and that is no medication for depression in the past 5 years, okay? Now again, none of these are disqualifiers. These are just simply questions to determine eligibility for the preferred select, okay? So even if they're in open enrollment or even a guaranteed issue situation, these questions can pop up in certain states, okay? And if they do, it's not to gauge their eligibility for our coverage, it's just to gauge their eligibility for our rating class, okay? So please just make sure you put the information in where applicable. It'll calculate the rates and provide you with the information that you need. The preferred select, like I said, is a way to not only get some discount, but mainly eliminate attained age increases. So it keeps the premiums level in those initial years, as you can see, okay? So if you've got somebody who's 68, they're maybe experiencing tons of rate increases with their current plan, but they're super healthy, you know they're going to pass underwriting, that would be a perfect opportunity to get them in our program, get them the lowest rates, and stabilize that for a couple of years for them, okay? If all of this isn't enough, great rates, competitive details, everything else that we've talked about, great branding, and awesome tools and resources to use to complete your quoting and enrollment. We also have Amplifon hearing benefits we include in all the plans. Active and Fit Direct is also included in all levels of coverage, okay? And of course, if you need forms, brochures, materials, anything else about the programs, once you get contracted, here is our portal. This is where you can download and or do the dental and indemnity programs as well, okay? Obviously, I know CSG primarily for the Medicare supplement, but if they are looking to add additional plans and they want to bundle and do things like that, this is where you can access additional information, resources, and complete those through our portal as well. So with all of that being said, I hope I stayed within my time frame, but if there are questions, concerns, if there's anything else that I can be of assistance with, please don't hesitate to let me know. There's a lot of exciting things going on with us right now, and I wanted to make sure that I didn't take away too much today, but I got enough out there. So again, if you want to learn more, understand more, or have questions, please feel free to let me know.
And I love how everything you covered, Craig, you can track all that within CSG, which we're going to show you. So we're going to show you how you can even track the age increases and really see that difference between the preferred and the preferred select. You can do that right within CSG. So I love how everything you talked about you can do within CSG too. One question that we did have come in is, with that wearable discount, do you guys apply that at the point of sale or afterwards? And do they have a certain amount of time where they have to fill in or register their tracking device?
Great question. So we will give it right from the inception. Okay, so they get the discount with the application and the approval. Okay, we will send them a notice. We would like to think that within 30 days, that should be sufficient time for them to get themselves registered. If they're experiencing issues, they can communicate and let us know. I'd say initially we'll probably let it hang on for a little bit, but we are going to communicate you have 30 days to activate the device in order to maintain the discount. That's probably what we're going to communicate, but in practice, we'll likely let it go a little bit beyond that.
Perfect. Good. Well, I'm going to take over the reins here, if you don't mind, and we'll get started on the CSG portion. And Craig, I may kind of refer to you in a couple of instances, or again, as kind of questions come up with this, we can talk through this. So what I have here is I have CSG pulled up on my screen. So a couple of things I'll point out is, one, all you have to do to run a quote is entering in that zip code. It populates the county, the city, and the state in the upper right-hand corner. From there, you can adjust your age, your gender, your tobacco status, how you want to sort, and then the plan. So it defaults to Plan G, but if you want to change that, you can do that. And then I would recommend making sure that you move your effective date forward. Now, some of those, I just looked, some of those 10-1 rate adjustments or those new plans aren't loaded into CSG yet, but that's something that our team is currently working on. So we will have those 10-1 rates that Craig referred to in the system soon. They're just not available on there yet, but move your effective date forward. Now, the first option for looking at those different household discounts is when you're running this initial quote. So if you want to run the quote initially and have all of those household discount rates populate for you, you can hit applied. That way you automatically see the household discount rates. Not applied would just be your rates without those household discounts. So once you hit your get quote, we'll be able to toggle discounts on and off as well and really see the differences in those different rating classes within CSG. We'll even be able to show you how the rate changes annually as well. So, of course, I'm in Omaha, and National Health Allstate is the top carrier here in Omaha. So you can see here how their initial plans start by showing up here. Craig mentioned is about on the left-hand side having your expand quotes. That way you can see what the rating class is over here. So if I would have this unchecked marked, here's where you would see that National Health kind of 4 times right here in a row. So if you wanted to see which rating class that belonged to, make sure that this expand quotes is on. So that way you can see rating class wearable, rating class preferred select wearable. Now, Craig, can you explain why we have 2 rates out there, one for wearable and one preferred select wearable? Keep in mind, I quoted a 65-year-old.
Absolutely. So typically, so the preferred select is an underwriting class, and preferred select, again, has slightly different performances within it. The reason why they're the same, though, is at 65, the preferred rate and the preferred select rates are the same. So for 65 and at 66, the preferred select rate is going to be the same as the preferred rate. The difference, though, is if they qualify for the preferred select, it'll stabilize the rate over the period of time, whereas if it's the preferred rate, it's going to tend to follow the trends of just our preferred rate. Okay.
Yep. So thank you. That's a question that we get asked a lot. So if I were to quote a different age, you would see that we would have a different rate for the wearable and then the preferred select wearable. But as he mentioned, when you start looking at the age increases, over here on the left-hand side, we can click on our market analytics and we can see how the age increases are different. Whereas he mentioned the preferred select has those stabilized age increases, and then the wearable does not, as you can see them on here. And you can also see the increase history too. So you can see how these different discounts have taken, he did mention a rate decrease. So you can track all that within here as well. So you can have your market analytics on there to see those. And then if I also continue scrolling, I have the preferred select without the wearable, and then I just have the regular no wearable, which is, again, because I quoted a 65-year-old, it's going to have the same rate. So you have the preferred. So that's where you can see the rating classes. Now keep in mind this was all without household discounts. So if your client will either qualify for that roommate discount or the multi-policy, or the husband, the spouse, the different discounts that are available. Over here on the left-hand side, you would check mark apply discounts. And then if I scroll up here, you can see how we have the dual, and then we have the household with the preferred select rating classes. Again, same rate, just because I quoted a 65-year-old, but it would be different. So here's the dual, household. Okay, so here's where all the rating classes are at. If you have any questions on those as you're quoting it, you can always reach out to us. We're happy to answer any of those questions. They can also get an additional discount if they pay annually. So again, over here on the left side, underneath your adjust view, if you hit annual rate here, you can also see the cost of those annually as well. And pretty big, you guys, and the next carrier down. Pretty big jump, or pretty big discount there if you're looking at. You guys dominate all of the ones all the way down until. So again, probably most competitive you are quoting them annually on here. So check out what their rate is.
And just to confirm that when you select the annual rate, this rate that reflects here is already calculating the 10% out, right?
Yep.
Awesome. Perfect.
Yep. I just had one question. If you have any questions on any of these rating classes before we get into the application itself, feel free to ask those. One question, Michael, you have, what exactly is the meaning of wearable? And that's just wearing a tracking device, like an activity tracking device, like an Apple Watch or Fitbit, just them registering their device.
Yep. Yeah. Historically, we got, and that's exactly correct. I mean, most people wear like an Apple Watch. And so that's kind of where we got that, the word wearable from. But then we quickly realized that, see, there you go, exactly. But then we realized, that cell phones, most smartphones also have that technology kind of built into them as well. And so it does span a little further than just the watch or the Fitbit or the Apple Watch. But that's just kind of where the name came from.
Yeah. I have some questions coming in on doing comparisons as well with the different plan types. Ernest, that was your question. So you can compare their G to their N side by side. So how you would do that is if you would run your quote for the G, just like we did here. Over here on the right-hand side, you can click this checkbox, this compare quote, and then you can quickly change your plan from a G to an N right up top here, and we'll load in all of your N, and then you can just click on that box to then put that G in that N side by side. So now I have my plan N loaded. Checkbox that. So now I have a G and an N side by side, and then you can go and you can do the same thing for a male as well. You can come in here and you can change the male and hit get quote. That way you can go into a house with a husband and a wife, and you could have both of their rates side by side for them. Already did your comparisons ahead of time. And then what you can also do within CSG is you can use that universal compare to stack different products. So you can then do a quote or present a quote with the dental on top of it as well. So you can do your dental quoting and your ancillary quoting products in here. So now if I click on that compare quote, just for example, I have a male and a female Plan G and Plan N option side by side in that comparison. So hopefully that helps you out, Ernest, on being able to do those comparisons. I know a lot of agents love to be able to stack different products side by side and really show their client their comparison. So that's awesome. Let's gonna go ahead and we're gonna jump into the eApp platform here. And then if you have any other questions, we'll get to those questions here in a second. So I am just going to switch my screen. I'm going to pull up my particular testing environment just so I can submit an application start to finish and hit that submit button without it actually being sent over to National Health. So again, I'm just going to run that quote like I previously did. I am going to move my effective date forward to make sure that effective date carries over into the application that I quote on here. And then any carriers that are on the eApp or products that you see, you will always see this apply now and an add to cart option. The add to cart essentially allows you to create a client shopping cart, so you can stack multiple products to your client's shopping cart, or you can just start by apply now button. So first, make sure that before you hit that apply now button, you have all of your rating classes figured out, which one they qualify for, household discounts, wearables, things like that. Make sure that's all taken into account before you hit that apply now button. So once you're ready to do that enrollment, hit that apply now. The first time that you try to do an application, it will ask you to validate that you have a contract. So you do have to be contracted in order to get into the application platform. So it's just going to tell me that it's missed my credentials. So I'm going to go ahead and enter in my writing number. That's what it's asking me, or my writing number. I'm going to hit update. The system will accept that. Basically, we ping their database to validate that you have a contract. Once that is updated, it will then take you right into the e-application here. So this is where it's just going to save you a lot of time. You're already on the CSG quoting tool, running your quotes, come right in to take an application. You'll notice here on the right-hand side, that quote that I ran automatically carries over here on the right-hand side. I do have all of my initial documents, so if I needed a copy of maybe the outline of coverage or the guide or any of the disclosures, I can view all of those initial documents. If I wanted to email these documents over, I also have that option as well. It carries over your name, your agent ID. Again, this is my test case here, so that's where it says test. And then we're going to start by selecting the underwriting type. Now, the reason why you have to select your underwriting type first is that based upon your underwriting type, you would have different sections over here on the right-hand side that you have to go through and complete. So right now, all of the sections are free until we select our underwriting type. In this example, I'm going to do an open enrollment, but if I were to do a fully underwritten app, it would have those health sections that I would have to go through and answer those questions. The great thing about this application process is it will notify you if you do select the wrong underwriting type, and we also have the definitions of those underwriting types in there as well. So entering the state, the Medicare Part A and Part B effective dates. Again, if I accidentally selected guarantee issue instead of open enrollment, you have your notifications tab over here on the right-hand side where it's going to populate a big red box and tell you that you have the wrong underwriting type and your client actually qualifies for open enrollment. So all of the smart technology is really built into it just to make sure that you are submitting that application in good working order. So as I get into the application now, you'll see that I have the sections over here that I'll have to go through and complete. As you go through and complete a section, you can go ahead and hit continue. Otherwise, you can hop to the different sections over here on the right-hand side as well. We do have some notes or some disclaimers in here just about that their rate is subject to change, or just making sure that you have the correct discount selected as you're going through your enrollment. So have those in front of you there so that you confirm the discounts intended, yes. And then for plan type, you can see that if I did want to switch it over to an N, I could do that, but the plan F is grayed out because they're not eligible based upon their Medicare Part A and Part B effective dates. And then we just go through this application start to finish here. So we're going to start by getting a title. And then your resident address carries over your zip, your city, your state, telephone number, and then I'm going to use, just for example, my email so I can show you if you were doing a remote signature what that email process looks like. So I'm going to just put my sample email in here. Carries over the date of birth, the age, the gender, and then you can go ahead and enter your height and weight. Again, anything that is a requirement to have that asterisk, use tobacco, no, and then I'm going to go ahead and hit continue here. Again, the green check mark and the yellow air icon, green check means that section is complete, it's accurate, and then the yellow air icon means that there's just missing information that I'll have to go through and complete. And then just answering these questions appropriately, answering yes to the activity trackers. And then I did quote without a household discount, so it automatically came up next year. And then hitting continue. Now the great thing about this e-application is it's saving as you're going through, hitting continue. So we all know our phone may ring, somebody may come into our office, your client may not be available, or they accidentally left their banking information at home. You can always come back into the application, so everything is saving as you're going through the application, which also makes it pretty nice. You can enter in that security number, carries over those Medicare Part A and Part B effective dates. Did you enroll in Medicare Part B? Yes. Did you turn 65? Yes. Become eligible. Did you first become eligible due to age? Yes. Did you receive a copy of the guide? Yes. And then again, hitting continue on to the next section. Again, you can always hop around to different sections. So again, if you wanted to come back to a section, all you would have to do is click on that particular section. You don't need to go to the back. So this is just your previous or existing coverage information section. If you were answering yes to any of these questions, additional questions would populate for you to answer. Especially if you had like another Supp policy in force. If you selected yes, you can put in those effective dates and the term dates there. Just because this is a test case, I'm just going to select no of those. And then we'll get into the method of payment section. The method of payment section will vary based upon what National Health will accept for payments. So they offer direct bill, automatic bank withdrawal. So you can select those different options and how you'd like to pay for that, when you want that initial draft to come out on, and then the ongoing payments. And then here's where you can start by typing all the bank information, checkings or savings account, routing number. You can either type in the bank name or you can type in the bank routing number, and it's going to populate those different bank options for you. So you can select which one. Account number. Is this a business account? No. First name, last name. I am the authorized signer on this account. Do you agree to reserve your certification or any other plans electronically? Yes. And then continue. And then here is your to be completed by producer section. Type of sale, whether that was telephone, in person, internet, mail. Has the applicant had any other enforced policies? No. We're going to send the policy to the applicant. Is there another person present? No. Are you related? No. Did you receive the application for correctness or any omissions? Yes. Did the applicant review the application for yes? Produce their phone number. So again, these are all the standard questions that they have on their paper application. We just put them here electronically for you. So all of the same questions that are on their app, their electronic app, all the questions that are on their paper app, everything is going to be the same questions within CSG. If you have to upload any supporting documents, you would do that here in your to be completed by producer section. And then once that is all done, you can hit verify application. So hitting verify application, this just gives you one last opportunity to review that application start to finish. And then if you found any errors as you're going through here, you can quickly just hit edit section or hop to the section over here on the right-hand side. So we can quickly go through here and just see that everything has been completed. Once we're done with that, we can go ahead and we can hit lock and e-sign, and then we can start getting into our electronic signature options. Before we do that, we do have to consent to the doing the electronic signature process. So you'll have to scroll to the bottom here and hit accept. If they wanted to print out these disclosures, that's where you have that print button located. And then we do provide you a couple of different signature options here. So you have the applicant providing identification information, you have the email signature link, and then you have the text signature link. So you do have some different options here. If you're in the same physical location, you have that applicant providing identification information. So in this case, if you wanted to do it, this option, what you would have to do is the applicant must open and review the following forms. So you do have to open up each of these documents. Once you open up the documents, it will then turn the bar green. And then you can see all these are just opening up in separate tabs. You can see here, this is the application. So this is where we went through that application electronically and just filled everything out. Payment, and then health information section. Once everything has those green boxes, you can check mark I have received, read, and kept a copy of the above documents. Their electronic signature would be their mother's maiden name, the last four of their social security number, acknowledging the city, the state, and the zip code that they're signing in. Apply e-signature. It will carry over your producer name and your agent ID number. And then you would just check mark apply e-signature, and then you would hit sign application. So that's the process. If you're in the same physical location of them and you're doing that in-person signature, which would be their mother's maiden name and the last four. If you were not in the same physical location, we do have the option for you to do an email signature link or a text signature link. These work essentially the same way. So the screens that I'm going to show you on the email signature link would be the same screens. They would just pull it up on their phone. It would send them a text message instead of an email. They do have to have a smartphone because it does have to pull the internet for them to review the documents and sign it. So it does have to be a smartphone. So we're going to do email signature. If the email that you had in the applicant information section is different from the one that they want to use, you would have to go back in and edit that email in the applicant information section. And then text signature, we do allow you the option to change the text here, just because if they had like a home phone number and you wanted to change that over to a cell phone number, we do allow that option to change it. And then all you would have to do is make sure you hit that apply e-signature and then sign application. So make sure that your client is available to do that email signature link when you send them the email. We do allow a 2-hour window for them to sign that. So that's why I recommend making sure that they are available. You can see here that it is now saying that the application is pending the applicant's signature. And then it does give you, again, one last opportunity to review the documents here. Then if you click on View Applications, you'll be able to note that it is pending. And as that is going, I am going to open up the email that the applicant will receive. So you can see here for Susan Smith, it says that it has been producer signed. This does not mean that they have signed it yet, though. So you do have that option to resend the signature if it has been past that 2-hour window that we allow you. Otherwise, if they are reviewing the application and they did notice an error in it before they signed it, you can go in and edit that application, and then any edits would require you to resend the signature, which would generate a new email and a new code for them to sign. So let's get into what this email looks like here. I always feel like it's important to show you what the email looks like too, just so you are aware, which is why I like to do the email as a sample here. So this is the email that they would receive if they were doing it with that text option. It's the same thing. It's just that this link and this code will be sent to their smartphone instead of an email. So they'll have to write down this code or copy it, click Verify e-signature, and then they have to enter in that code, and they have to enter in their date of birth. Please make sure that you have their date of birth correct on the application. If you had the wrong date of birth and they enter in a different date of birth for their signature, it would not allow them to sign it. So you do have to have that correct on your application. Hit I agree. This is just agreeing to the terms and the conditions of that electronic signature. And then same screens as if they were face-to-face with you. They have to open up each of these documents and review them. So they have the outline of coverage, the disclosures, the guide, the application, the payment off, the health information. So all those documents, they will just open up a new tab so they can review them. Again, you have those guides, the application, everything is there. And then they will check mark, I have received, read, and kept a copy of the above documents. They're going to go ahead and acknowledge the city, the state that they're signing in. And then apply e-signature, and then sign application. Once they hit sign application, it will just say that it is processing the application or preparing the application. So have them keep that open until it shows them the submitted notice. And then again, they will have an opportunity to review those documents once again. So it says, thank you for submitting your Supp application. Perfect. So you, the agent, if you go ahead and you just refresh your applications panel, you'll notice that your status will then change to submitted. And that's how you know that we have submitted it over to them. So now it's been submitted. You can always view a copy of that application here too if you click on View PDF, and then we do have links out to the National Health Fair Agent Portal, so you can always check the status of the application there as well.